It's also important to have resources to deal with bladder, bowel, and sexual dysfunction, which are common. So that's the core components of the medical care for MS. But as I mentioned earlier, there's all of these other issues that patients have to deal with that don't necessarily fit in the usual medical model. So when we were thinking about that, you think about how the MS patients define themselves as people, not as patients, but as people. And I'm pretty sure they don't define themselves as the person with MS or the person that's on this treatment or person with certain EDSS or things like that. They really define themselves more by what their family, what's their role in the family, or they're doing their family thing, or what their job might be, or what they do for recreation. And so we've also thought about those components and how we might help people restore those parts that have really been torn away from them. So thinking about these three areas of wellness, the physical wellness, I touched on some of this, like physical and occupational therapy, it can help people with that. But exercise is very important in maintaining your physical abilities. And a lot of our physical therapy program is geared toward getting patients back into exercise. And our PT gym is, we have a lot of equipment in there that is for exercise so that people can try it out and see what works for them with a therapist overseeing it. And they can come in and our physical therapists work with them. They come up with an exercise program, and then they can take that program back to their local community to carry out. An example of that is we had a patient a while back that, for whatever reason, likes the stair-step machines, but she has horrible coordination, and so she keeps falling off the thing. Well, we have a recumbent stair-step. You can't fall off of that. And it turned out that was the thing that resonated with her. And she was able to take that knowledge to her local community, find out that the Y, which was the cheapest gym in her region, was the only one that had a recumbent stair-step machine. So that, was a good solution for her.